Social Work with Older Adults in the Healthcare Setting by Zambia Clark. At the age of 65 and older, there is an increased risk of attempted suicide as well as a higher rate of success for the attempted suicide. Some of the contributory risk factors include those who live alone, those who have limited to no social support, those who have been recently widowed, many who have physical illness or uncontrolled pain or fear of a prolonged illness. 70% of the victims had recently visited their primary physician within the previous month. However, there were no signs or risk factors that may have prompted the physician that their patient would attempt and successfully commit suicide. 72% of the suicides committed in 2012 were used by a firearm. The elderly demographics. From 2005 to 2015, the elderly population increased by 30%, yielding 47.8 million elderly people in the United States. This number is expected to double by the year 2060, yielding 98 million elderly people. Community-based versus institutionalized elderly. In 2013, 30% of the Medicare beneficiaries had difficulty completing activities of daily living, also known as ADL, and 12% more had difficulty with more than one instrumental activities of daily living, also known as IADL. Institutionalized elderly had 95% of their Medicare beneficiaries had difficulty with one or more ADLs, and 81% had difficulty with 3 or more ADLs. So from the statistics, it seems that the elderly that are institutionalized have more problems completing their activities of daily living. What are ADLs? Activities of daily living include eating, bathing, toileting, getting dressed, transferring, and consonants. IADL includes preparing meals, shopping, paying bills, housework, managing money, using the telephone, and taking medications. According to the Texas A&M Vital Statistics, the top 10 health issues faced by the elderly include chronic health conditions, cognitive and mental health conditions, physical injuries, STDs, malnutrition, sensory impairment, poor oral health, substance abuse, bladder control, and constipation. The top 6 health diagnoses in the elderly are arthritis, heart disease, osteoporosis, Alzheimer's disease, diabetes, and cancer. What is the difference in working with the elderly? There are psychosocial barriers to treating health problems in the elderly, as well as a lack of knowledge and misconceptions about their own health issues. Many elderly people are lonely and have horrific familial issues. Therefore, when receiving a negative health report, it may lead to depression, anxiety, substance abuse, or even violence coupled with their negative health report that they just received. Many of the elderly have comorbid conditions. That means having 2 or more chronic health conditions at the same time. 60% of the population between the ages of 75 and 79 have comorbid conditions. 75% of the population between 85 and 89 have comorbid conditions. What are some of the challenges of the elderly within the healthcare facility? One of them is them not taking the medications as prescribed, and this is many times due to finances not being able to afford the medication, so the patient will not get the prescription filled, or they'll fill the prescription and not take it as prescribed in hopes of stretching out the medication. It has been shown that Medicare recipients of the lower socioeconomic status who didn't take their medication had worsening chronic conditions such as arthritis, heart disease, hypertension, and depressive symptoms. Another challenge is poorly integrated health services. Numerous healthcare services continue to be poorly integrated and difficult to access, especially for lower income ambulatory older adults with an increased risk for a range of co-occurring medical, dental, and social problems. How are social workers addressing these issues? The issues are addressed through the administration of a comprehensive geriatric assessment, also known as a CGA. The CGAs are administered by a healthcare team, and they encompass gathering information about the patient's medical, psychosocial, functional, nutritional, and socioeconomic status. For the elderly that have chronic issues, their health team will be led by a geriatric physician. Some of the people on the healthcare team would include a cardiologist, a nutritionist, a geriatric psychiatrist, an optometrist, an audiologist, an internalist, a nephrologist, a pharmacist, physical therapist, a urologist, a rheumatologist, just to name a few. The multiplicity of the CGA helps the social worker to prioritize the needs of the patient. Dental issues have been linked to depressive symptoms within the elderly. There was a pilot study done in San Diego, California at a senior wellness center that serves approximately 900 seniors. And what they did was they integrated a dental clinic within there. And most of the referrals that the center were giving were for the dental clinic. So this model proved that by having all the services in one area, it was better for the patient. The co-location model was beneficial to the comprehensive care of the elderly. So how are we addressing this issue of the patients not taking the medication as well as the poorly integrated healthcare services? As a social worker, we should have general knowledge about medications and the potential side effects. So as home visits are done, we will be able to recognize if an unspoken help is needed, as well as be familiar with the patient's diagnosis in case we see some emergency symptoms that may need to be referred to the physician immediately, because the social worker is the mouthpiece between the elderly patient and the other medical professionals. The social worker should also be knowledgeable about social disparities that may be impacting the client's ability to follow through with care, which would include the lack of transportation, them being ignorant to the information they received about their health, lack of finances, not being able to have enough medical coverage for the treatment that is needed. At the time the patient is feeling good, so they just flat out ignore the physician's recommendations. Distance may be an issue for them, where it's too far, too long. They don't want to be traveling for that long of a time, and just fear of the unknown. How can the social worker help the client? And what are some of the resources that are available to the client? It is the social worker's job to become aware and knowledgeable about the resources that are available on the local as well as national level for the patients that they are servicing. Here, for the patients that are having issues with purchasing medication, we have the Medicare drug discount cards. They also have pharmaceutical company programs that will help patients get medication at a lower price if they do have income disparities. And they also have medication assistance programs. Some other local and national resources include the AARP, and this is headed by volunteers, legal advocates, and organizations that come together for adults that are 50 and older to help them get things such as nutritious food, stable, affordable housing, steady income, and social integration. We also have another organization known as Meals on Wheels, which provides food to elderly who do not have transportation or it is hard for them to get out. Then we also have the Elder Care Locator, which is a free and national service of the U.S. Administration on Aging and an initiative of the National Association of Area Agencies on Aging, and it helps find local resources such as financial support, caregiving services, home repair and modification, transportation, and more. And they can be located by calling 1-800-677-1116 or simply by visiting their website. Then we have the area for agency on aging, which provides nutrition and meal programs such as counseling as well as home delivery of meals, caregiver support, information about assistance programs, insurance counseling to seniors, transportation. They also help families fill out applications for Medicaid, respite care, and veterans program, and they do also offer case management services. And we also have the National Council on Aging, which helps people ages 60 and older find services that are available for financial security. And the National Institute on Aging helps give information for people ages 50 and older on physical activity and exercise to continuously be incorporated within their daily lives. What distinguishes me from all the other workers within the health team as a social worker? As a social worker, my job is to service my patient, whatever it is that they feel they need help and assistance with. It is my job to help them and to help empower them. Dignity and worth of a person, many times when these negative health reports are received, it brings a person down. They feel worthless. Sometimes they may not want to go on anymore. But it's my job to continue to build up within themselves their strengths and let them know that they can make it, and the health diagnosis is not their final chapter. Importance of human relationships. Again, many elderly are lonely. They don't have any family. So this also plays a major part on their health. So I will help to integrate them within community groups that have their likes, and as well as other groups that may be different from what they're used to experiencing, just so they can have the human interaction with one another. Integrity. I vow to be a person of my word. I vow to follow the social work code of ethics and to work within my competence for the patients that I serve, and to use the strategies and evidence-based theories that I have learned throughout these courses. It is my job to promote the well-being of the client as I listen to and contract with the client, and see what is it that they need to get them back physically healthy, emotionally well, financially stable. It's my job to promote the whole well-being of my client. Self-determination, allowing the client to see what they're able to do to add to the wholeness of themselves. It is also my job to be culturally aware of different cultures that I might service, what's culturally acceptable and what's not, because across cultures, different values and different beliefs do exist. As well as being aware of the social diversity, is my job, just like I said, to help everybody get to where they need, basically for the promotion of their well-being as a person. These were the references that were used for this PowerPoint as well as this presentation. Thank you.